This is For Your Health with Dr. LaBeau. The month of March has been designated as Brain Injury Awareness Month. The Brain Injury Association of America has found that more than 5.3 million children and adults in the United States are living with a permanent brain injury-related disability. Brain injuries typically are caused by impact or force into the head or to the body. The problem is, even with a solid structure like our skull, the delicate brain, when the skull gets rattled, can be seriously damaged and injured, causing bleeding and impaired neurological function. Such natural causes like prolonged childbirth, as well as serious impact and injuries like falls off a trampoline, sports injuries, and car accidents can lead to brain injuries. The worst brain injuries lead to concussion, where the symptoms can last weeks, months, and even lifelong. Now let's look at basic anatomy of the spine. See what happens during a whiplash. So here we have the pelvis, the spine, miniaturization obviously, with the skull at the top. The most critical junction of the body I consider is right here where the neck and the skull meet. Reason being is that you have the little nerves and blood vessels that they're designating here, nerves being yellow, blood vessels being red. When any impact is affected here, the muscles will be in a state of contraction and impedes the flow both up to the brain as well as allowing the nerves to be fully functional in their circulation. Now let's next look at basic cranial anatomy. Here we have a skull, and what we call the skull is actually comprised of fusion of 22 bony plates that make up the skull. And they're joined at little areas here called sutures. You can see here. And we'll give you a little other demonstration here. We'll take a couple of sample bones, which here we see here the orbit, and this is the parietal or side bone of the head. They fit together like here. And you can see these little sutures very delicately fit together. And there's a little bit of motion, typically 8 to 10 times per minute ideally, to allow the spinal fluid to circulate and for the blood and sinuses to drain. Now, any lack of cranial motion can cause problems like chronic fatigue, dizziness, headaches, migraines, tinnitus, or what some people call ringing the ears, TMJ, visual disturbances, and impact many other neurological diseases just through impaired neurological function. The easiest way to evaluate brain injury is when there's an obvious deficiency in any physical or mental task that one was proficient at prior to the injury. What I want to leave you with is that there's much that can be done to help heal chronic brain injuries, even years later. And what I usually suggest is a trial of 6 visits done once or twice a week with the goal of observable change in the patient's symptoms. Other things that I tend to look for is to reestablish movement of the cranial bones, optimize spinal fluid circulation, and reduce nerve impingement to fully restore optimal brain functioning. This is why I refer to cranial osteopathy as non-surgical neurology. And this is Dr. LaBeau with For Your Health.